Now you asked about IV vitamin C and some studies, and I mean, there's a lot of studies on vitamin C, so I'm just going to cover the ones that pertain to COVID and 19 and what's coming out of China. And so, interestingly enough, there were 3 studies specifically that they did with protocols, and we're just starting to get some of the results of those. There's been some case reports already coming back on the vitamin C. And what we're finding is that it's not a cure for COVID, but it's a great adjunct. And one of the biggest things that I found out of the studies that I was reviewing is that it decreased the hospitalization by 3.5 days. That's huge. That just now increases the number of beds that are available for other individuals. And the other thing about vitamin C is it's cheap. I mean, it's really inexpensive to make. It's inexpensive to use. And most people tolerate it. There are a few cases where if you have I come from a Middle Eastern background, you may have difficulty in how you regenerate glutathione with glucose 6-dephosphate. And so G6PD is one that you're going to need to have checked if you're getting into higher doses, but usually not until you get above at least 15,000 milligrams of vitamin C, and most of the protocols were about 6,000. There were some at 12,000, and there was a case report of an individual who had SARS and was on a ventilator, and when they gave him 50,000 milligrams of vitamin C, his oxygenation improved significantly within 4 hours. So I think there's a role for it. There's a benefit of looking at it. I hope that that hospitals will take a look at that and utilize it. I think we're looking at lots of different ways that we can support the immune system and help the body in its recovery. And vitamin C really is a recovery vitamin. I think that's the way it needs to be looked at. We talk about immune boosting, but in reality, vitamin C is a recovery vitamin from that standpoint. It helps to recover reactive oxygen species, or ROS. It helps to regenerate glutathione, and at higher doses inside the cell can facilitate hydrogen peroxide production to actually induce a form of apoptosis of the cell that may be overloaded with virus.